I'm interested in exploring health-seeking behaviors of patients who do not access care in the pre-prescribed fashion. These individuals are often labeled as hard to reach, but are they actually hard to reach, or do we just know not how to reach them? Diabetic eye disease is a leading cause of sight loss in people aged 20 to 69 years old, with considerable psycho-socioeconomic impact on the individual and their families. Diabetic eye screening is a recognized method for reducing the risk of sight loss. However, there's a cohort of patients who do not attend screening for 3 years. In patients who don't attend for 3 years or just don't attend screening at all, there's a threefold risk of presenting to secondary care with sight-threatening disease. So the question actually is, what steps are we taking as a leading eye organization to improve the uptake of screening and to reduce health inequalities? A digital solution which is flexible and patient-centric and addresses the barriers and enablers cited in literature seem to be a good part of the solution. So for me, I successfully applied to the Topol Health Education England Digital Health Fellowship earlier this year, and here I am. No additional qualifications were required for this post. The Digital Health Fellowship has been designed to support clinical staff, Band 6 and above, to develop specialist skills, including the use of digital technologies, while giving enough time outside of clinical commitments to dedicate training for a digital future. We did, however, require support from our organizations to develop and conduct our proposed digital and transformation initiatives. But as I said, no additional qualifications are required for this role. Whilst undertaking this fellowship, I will continue to work clinically, and for me, that's in a research department. I will spend 2 days a week working on my digital transformation project and/or attending formally accredited workshops and mentorship sessions. And I'm also doing another fellowship, NIHR 70 at 70 fellowship. So my other 2 days a week is based on that fellowship. As a nurse, I'm focused on patient-centered care, and I'm adept at holistically reviewing services provided to improve the patient's care. I'm aware of the pressures faced by clinicians on the front line and the experiences of patients. As a researcher, I have a skill set required to investigate the issues at hand and determine viable solutions. Therefore, I am able to use my knowledge, experience, and networks to encourage the initiation and adoption of digital pathways to release time to care and improve the patient experience. I enjoy the flexibility my fellowship affords me. I'm able to continue my clinical work as well as learn about digital transformation, how it affects the workforce, how to incorporate agile ways of working, effective communication between teams, networking, delivering a project of national importance that may change the way care is delivered to a vulnerable group of patients. I'm also able to be a role model to my colleagues and other members of staff. When I started my nursing career, I did not appreciate all of my options. I would tell my younger self, think big, read wider, network more, take advantage of all opportunities that present themselves, worry less, and definitely pray more.